Thanks for joining us again on an all-new episode of Pinal's People. We're here today at the offices of the Pinal Hispanic Council in Eloy, and with us today is Chief Executive Officer of the organization, Ralph Varela. We're so happy to have you on the show.
Thank you very much, and I'm glad we're here.
Thank you. So to get us started today, I know that you have a lengthy history in Pinal, and you've been a part of Pinal Hispanic Council since its inception in the 1990s. For our viewers who aren't familiar with you, can you share a little bit about how you got started with PHC?
Yes, most definitely. I started as a counselor with BACA in 1982, and we created that friendship with BACA, and it was the goal of the executive director there to spin off Pinal Hispanic Council as a nonprofit that would stand by itself. So in 1990, I had the opportunity to develop that, and so here we are 33 years later.
Mm-hmm. Like I mentioned, you've been part of the organization since the 1990s. What made you decide early on that this was something you wanted to be a part of? And what do you think the impact has been over the last 3 decades?
Yeah, absolutely. I think for me, the impact has been bringing resources in, being able to assist communities, be able to partner with organizations, but ultimately is to serve individuals who come to our doors who are needing assistance, whether it's with advocacy, whether it's with emergency assistance, whether it's with counseling services, case coordination services, and then partnering with organizations that would help us all work together for the same reason, for the betterment of each of the communities. And I think for me it was driven growing up in El Paso and seeing my mom raise all 4 of us. My dad died when I was very young, and seeing what it was not to have resources, but also seeing the communities and how they helped individuals who didn't have resources. And my undergraduate degree and my master's degree are in social work. So it was just kind of a continuation of growing up and then wanting to do something to assist others.
Mm-hmm. And I love that you brought up the fact that the availability of resources, yes, and how important that is. For people who aren't familiar with what behavioral health services do, could you explain to some of our audience members, the impact that those services provide in people's lives? Absolutely.
Because we see individuals that come to us at a point in time where they're hurting, whether it's through emotional difficulties they're having, lack of resources, if they're being challenged with substance abuse, if they don't have housing, if they don't have anything they don't have a place to stay. And for us, it is really providing a safety net. And so part of it is a safety net, part of it is the advocacy that we do, but we also do a lot of prevention work with the schools and in the community, because we really want to focus from early ages to adulthood. We also provide crisis services, and those are real important because sometimes an individual may be in a situation where they're in a crisis and they would like someone to respond to that crisis. And I think for all of us, for us, this agency really is like a beacon of hope where someone can come here if they're hurting, if they're going through a difficult situation, or someone or a loved one is going through something and they don't know where to go. And so our organization really is here to provide those services that are going to have a positive impact. And so that individuals that come know that they're not alone. It's not just a service, it's just really a mentality that we help each other in the communities where we're at.
Mm-hmm.
Yeah.
What would you say inspires you most about the work you do here?
That's a very good question. I think helping individuals I think that's one of the big inspirations. I think the second one is seeing the staff and the compassion that they have for wanting to help as well. And then I think the third one is working in the community with all the partners, that I know earlier we were talking about it, a lot of the individuals who have organizations, we've all grown up together, whether it's with us or Cara or others, we've all kind of grown up together at the same time. So we have that passion about serving others.
And as I understand it, so Pinal Hispanic, of course, there are several offices here in Pinal County.
Yes.
But it's actually regional, correct?
Yes.
You have offices in Nogales, I believe, correct?
Yes.
And so...
And Douglas as well.
Douglas,
yes.
yeah. Thank you for mentioning that.
Absolutely.
And so one thing I would love to know is when, having been a part of an organization like this for so long, what's it like to see it grow and to see, of course there's an impact regionally, but there's also an individual impact as well, correct? You get to see in each person who walks through the door how it affects their lives and how it changes their lives.
Yes.
What's that like for you, getting to see that from going from a grassroots organization to now something that's become much, much bigger?
Well, definitely rewarding. Definitely rewarding. And part of it is that the fabric of the organization, it's really important that whether it's Douglas or Nogales or Coolidge or Casa Grande or here, that our mission still remains the same. And that is about making healthy communities healthier. And part of it is really focusing on when someone walks in the door, that we provide them the best service we can. And then we provide it within the scope of what is called trauma-informed, so that they feel comfortable, the environment is comfortable, and they can know that we're there to be able to assist them.
Yeah. And so aside from your work with Pinal Hispanic Council, you've also been fairly active in local communities here in Pinal. You've served on a number of boards and organizations, including Casa Grande City Council. You were also a member of the Cesar Chavez Memorial Committee of Pinal, the Pinal County Merit Commission, Eloy Governor's Alliance Against Drugs, La Familia Initiative, Corazon de Latinos Unidos, and many more. So it's very clear, just from your resume, that being a part of the local community is important to you. What would you say are the two most important things, your involvement in the community has taught you over the years?
It really has taught me, first of all, that there's a lot of individuals in this county that have the same passion, and that so when you're able to put everybody together in one room, doesn't matter who's running the organization or the committee, that everybody's really committed to that purpose. And it's also taught me that it's really important to have and control those resources. I always thought of that since my early years in social work, that it was really important that you have the resources. So whether it's an organization like Cesar Chavez, which is dear to me, is that being able to give scholarships to students who are going for their first year, and a lot of them are first generation college students going. It's really important because being able to get those resources and then being able to award them, and now they have resources to go to college. And what we always tell everybody is that just make sure you pay it forward. And I think that's been the same thing for any of these organizations, is that really we want to pay it forward, because one day, we'll all retire and there'll be other individuals that'll be coming and taking over the organizations and making sure they're sustainable and making sure that they themselves pay it forward. And I think the other thing I've learned here in Pinal County, because that's where we all grew up here, is that everybody's just so willing to help. We don't fight over resources. It's like a piece of pie, and we all kind of agree, who gets which piece of the pie and so forth. And And that's always been one of the litmus tests for us, and that is that, if we need something on housing, we know who we can call. If we need something for emergency assistance, or we need to help someone who's elderly, all of us have that connection, and all of us are able to assist each other. It doesn't take a lot, because we've been together for quite a long time. Yeah.
Of course, everybody knows that Pinal is growing. I believe we are one of the fastest growing counties in Arizona. And so, as you look out to the future and you look at, the future of organizations like Pinal Hispanic and even other organizations that you've worked with, what do you, how do you see their role changing? But also, how would you like to see them continue to foster that spirit of, working together and helping each other?
And now it's very interesting, because there's a pre-COVID and COVID and post-COVID, and a lot of the dynamics of organizations have changed. And one was that because there was so much funding that came out to fund different things and different initiatives, a lot of those are staying in one way or another, where they've been sustained. And so a lot of the organizations are growing in different ways. For example, for us, we partner with Pinal County, with the community health workers. And so that has created a new element of services to be able to reach out to communities, and especially individuals who need the educational pieces of it, whether it's related to thyroids or heart disease or diabetes and so forth. And before that was with COVID, obviously. And then, we're moving into doing medical integration. So we'll have integrated clinic here in Eloy, and we just started an integrated clinic as part of Casa Grande as well. So, and now we're moving into, we're hoping to put tiny homes actually right across our building here, put 15 to 20 tiny homes, and then 8 apartments in Casa Grande. But all of that came as part of this whole initiative with COVID and the funding that became available, because it obviously brought a lot of problems in terms of either homelessness or health equity, and lack of outreach. So a lot of the organizations have morphed into different things as well. And so you actually have different types of resources that we didn't have 6 years ago, or different types of initiatives. And a lot of the organizations are in the same boat. They're moving and adjusting and enhancing what they've had. So actually, Pinal County has more resources now than they had 4 years ago. Unfortunately, it was because of COVID, obviously.
Yeah, but do you think, so as the county grows, do you think we'll see more of that? We'll see more of, an evolution of what, organizations have been doing, kind of a shift in what they're doing? Because, of course, like you mentioned, the tiny homes, right? I understand that kind of got started with COVID, but right now, especially with what's going on with the economy and housing, that's more important than ever, is affordable housing. Actually, I'd love if you could share a little bit more about that project as well.
Well, it's in the planning phases right now, and so what it'll be is, and we're working with the city of Eloy, and eventually we'll get to planning and zoning, and then for city council for approval. But we're hoping to put 18 to 20 tiny homes. And we really want to make it quality and state of the art, so that it is really a little community by its all right across from where we're at. And we'll be able to provide the behavioral health services from here to there. So, and we'll have the medical integrated services here as well. So it really is, and then the last thing we want to do is also provide employment services as well. So it's really wrapping a concept around a project and providing all the resources that go with that.
What's something you wish more people in Pinal County knew about Pinal Hispanic and the work it does?
I think the biggest is the passion that drives the organization and the commitment to serving communities. I really think, if at the end of the day I was to, retire and look back and someone will say, oh, they helped a lot of people. They were passionate about it. They were committed to assisting others, and they worked together in partnership with other organizations. I think that would be most important. I think probably, I think the communities in general probably don't know the extent of the behavioral health services that we provide, the crisis services, the housing, the veterans. I think for a lot of individuals, actually, say Pinal Hispanic Council, you're really not sure, unless you said behavioral health, and then even behavioral health is one of those things you may say, I'm not sure what that really means. And so I think, we just continue to be good ambassadors for the services that we do.
Yeah, that's beautiful. I love that. One last question for you.
Yeah, absolutely.
So we've actually made it our mission to ask all of our guests this year this question. So let's imagine it's 20, 30, 40 years down the line, and you've managed to do all that you've wanted to do when it comes to supporting people in the local community and accomplished all the goals you had hoped to achieve for PHC. And you're ready to pass over the reins of the organization to the next generation. And of everything you've learned out of all what you've done over the years, you can only pass on one lesson or piece of advice to them. What would it be?
To me, that's an easy one. That's easier than your other questions. To me, that's the easiest one because we're always saying, be a servant to the community. And so as we pass on our organization and moving forward, and especially for the younger generations that are coming, is to be servants to the community. Because, if you're grateful and you're able to pass that on and be able to pass on that compassion and about helping others and paying it forward, I think then you've done a good job.
Varela, thank you so much for coming on the show.
Absolutely.